One thing we need to start realizing, and the textbooks will take a while to get rid of this term because it's ingrained in our soul as students and medical students who eventually become cardiologists or ER docs. The concern should be this. STEMI is not a great term. Oh, those need cath. Those need emergent opening of a vessel. Those that are non-STEMI are lesser patients who still have some conclusive disease, but we're not supposed to take them emergently to the cath lab. Unstable angina means new chest pain or changing the chronic chest pain you get. Do you have troponin and you have an EKG that looks like this? No argument. But not all EKGs are going to have STEMIs. And some patients need cath emergently for persistent chest pain, abnormal vitals, cardiogenic shock. A guy who's young who gets Vtach for no reason is not from cocaine, not COVID. Maybe he has an inherent vessel that's occlusive, right? Maybe he needs a cath to confirm to everyone he has no LAD lesion. Unexplained bradycardia, positive troponin. Oh, it's just because heart rate's low. Why is this going to happen all of a sudden to a guy who's having chest pain, who's diaphoretic, and looks like crap? Right? And potassium's normal. Younger guy, 35, 40. Right? I even had a 23-year-old who spilled troponin. EKG is barely positive barely abnormal. Positive troponin, got cathed at the age of 23, a non-compliant diabetic with collateral coronaries for her RCA lesion that after we put it in, the stent in, her GERD-like symptoms of nausea and epigastric pain went away. Will I have known this as a new grad, as a new attending? No. Will I have known this as a very smart EM resident? Maybe if I listened to this lecture. Not all STEMIs are equal. Not all non-STEMIs are equal. We should use the term OMI, occlusive myocardial infarction, because something's occluded, causing a heart attack. And there are some patients who have no EKG changes, but have high risk. Family risk, brown, not Latino brown, but brown from South India, with relatives that hung out in Trinidad, Guyana, Bangladeshi. Gotta be careful. Those are risk factors that are not in any heart score. But if you ask anybody from Bellevue, downtown New York, or a doctor who works in Elmhurst, or a doctor who wears NYP, or someplace in Flushing, Queens, I'm going to tell you, you'll know the reality. Not everyone in New Penn knows what they're talking about. Not everyone in wherever they did the heart score, like in Amsterdam, they don't know about this type of disease. That should be another risk factor. The unofficial modified heart score. That's one risk factor you can't ignore. Men or women. Please understand the lesson. OMI is the way to use the term. And hopefully new generations will understand OMIs matter. The word STEMI and non-STEMI, Q wave, non-Q wave, that used to be a big thing. There's a Q wave. Oh, it's a heart attack. Non-Q wave MI. Troponin's positive, but it's not Q'd out yet. Q's doesn't mean some disease is starting to happen. Will you Q out completely? That's a bad sign. Let's not wait for that. Save that heart. Every minute, myocardium suffers.